Good afternoon. My name is Carlos Guardado, and today I'll be doing an informative speech on how to do CPR. I can think of many situations where I've gotten a call at work and we get dispatched to a person down, somebody in cardiac arrest. I have adrenaline rushing through my body and I'm running through a game plan in my head, what I have to do to make sure this person has a fighting chance to survive. So what is CPR? According to an article titled "What is CPR?" by the American Heart Association, states CPR or cardiopulmonary resuscitation is an emergency life-saving procedure performed when the heart stops beating. Immediate CPR can double or triple chances of survival after cardiac arrest. Performing CPR properly and knowing how to perform the steps can double or triple the chances of survival. Knowing how to properly and effectively do CPR is going to be a life-saving skill. I've been a paramedic with the El Paso Fire Department for about 4 years, and CPR was a basic skill that we were taught when we became EMTs. In this speech, I'm going to explain what is CPR, give a little rough instruction on how to do CPR, and explain the survival rates behind CPR. And the main topic is knowing how to do CPR and why it's important. So the first point, what is CPR? According to Brenton Rule A, Harvey D, Morin K, O'Brien D, and Weber J in 2021, in the article Knowledge and Perceptions of Cardiopulmonary Resuscitation amongst New Zealand Podiatrists, define CPR as cardiopulmonary resuscitation. CPR is an essential life-saving skill when applied to people who are unresponsive and not breathing due to cardiac arrest. CPR involves a combination of chest compressions and rescue breaths ventilations in a 30-to-2 ratio, according to best practice guidelines. Again, CPR is a life-saving skill. If we know how to properly use it, it can double or triple chances of survival. It involves 3 simple steps. First step is airway. Is this person breathing? If not, you perform a head tilt chin lift to open the airway. Step 2 is the breathing supporting the person's airway. A quick test is to look, listen, and feel. Make sure this person is breathing. And step 3 is to feel a pulse. If you don't know how to feel a pulse, an index finger or a middle finger in your neck, give you a quick test to check a pulse. Knowing how to perform CPR is crucial, but also recognizing the symptoms is also important, right? So one of the symptoms is this person exhibiting any signs or symptoms. Is he unresponsive, not breathing? Other visual clues to look for are patient bluish to the lips, which indicates poor oxygenation. So now that we discussed what is CPR, let me show you how to do CPR. According to an article by Mayo Clinic titled Cardiopulmonary Resuscitation CPR First Aid in 2022, the American Heart Association uses the letters CAB to help people remember the order to perform the steps of CPR. C, compressions, A is airway, and B is breathing. Now that we know CPR is a combination of compressions, let's begin with the proper placement of our patient, right? So this is going to be our patient for today. All right, it's going to be Billy. All right, we're going to place Billy on a hard surface. If there's no hard surface available, try to place them either on the floor, not on the bed, because the bed's too spongy. You need a hard, flat surface. You check the pulse, right? We can check on each side. About 10 seconds, no more than 10 seconds, make sure if he's breathing or not. If he's not breathing, you begin chest compressions. You can check also when you do CPR, make sure he's breathing. Quick test is to look to see if his chest rises. Listen if you see any flow coming out of his mouth. According to an article of CPR Certification Online headquarters titled "The 7 Fundamental Steps of CPR," while CPR can be confusing or overwhelming for someone who's never done it before, it's fairly easy. First and foremost, before you start CPR or any other medical care, just like the article mentions, it can be overwhelming to perform CPR. So let's break it down. So you're going to start by using your right hand, your dominant hand, putting on the victim's chest. Grab your other hand and you interlace your fingers and you compress the chest. You keep your hand straight and you compress it for 30. If you're finding trouble keeping the rhythm, you could use the song "Staying Alive," which is going to help you keep rhythm. You're going to do this for 30 compressions. Once you're done with your 30 compressions, you're going to transfer to 2 rescue breaths. You would open his airway, and we're just going to simulate because I don't have a mask, but you will use a barrier and simply until you see chest rise for approximately 2 minutes, and then you would check a pulse and recontinue the cycle. So we would do 30. Then my partner will provide 2 rescue breaths. And if you get tired, you can always switch up the roles and make sure you can alternate roles. Let's talk about the survival rates of CPR. According to Reva G, M. Johnson, Hurlitz J, Clayson A, Nordberg P, Nord A, and Hollenberg J, in 2019, according survival in an out-of-hospital cardiac arrest after standard cardiopulmonization or chest compressions only before arrival of emergency medical services states there was an almost 2-fold higher rate of CPR before EMS arrival and a combination 6-fold higher rate of co-CPR over time. Any type of CPR associated with pre-hospital will double or triple the rates. Just like the article mentions, any type of CPR is better than none, right? You know, as long as we get there, perform CPR, you're giving this person a fighting chance, right? According to Staff P in 2020, April 8th, CPR facts and stats, what is the CPR success rate? Retrieved April 14, 22 states, recent statistics have shown that earlier CPR is performed, the higher the chances of survival after cardiac arrest. Nearly 45% of out-of-hospital cardiac arrest victims survived when bystander CPR was administered. Like I said, nearly 45% survive. So if you perform CPR adequately and correctly, you're gonna save a precious life. So just to get a quick summary again, right? You're gonna place your patient on a flat surface, and then you're gonna put your dominant hand over the person's chest, interlock, and keep your hand straight and perform 30 compressions, right? And after the 30 compressions, you're gonna provide 2 rescue breaths open and then breathe until you see the chest rise. You're gonna perform 2 cycles of CPR and then you will check a pulse. And you would do that until EMS arrives. Conclusion, I hope I was able to show you what is CPR and how a quick demonstration of how to perform CPR and the survival rates of CPR. Thank you.
You have to show us again.
Huh?
You have to show us again.
Oh, shit, you're right. Oops. I have my uniform on.